everyone. I'm Mrs. Princey, Associate Professor in Mental Health Nursing. So today I'll be continuing with the depression. So I've already explained about the meaning of depression, the various types, the causes, the clinical features, and everything in video number 1. So this is video number 2, which is going to be the continuation of video number 1, wherein I'm going to discuss about the treatment and nursing management of patient with depression. If you take the treatment modalities, we have got the 3 treatment modalities. One is the psychopharmacological agents. Second one is the physical therapy. The third one, we have got the psychotherapies. Let us see in detail about each of the treatment modalities. So first one is the psychopharmacological agents. The drug of choice for depression is the antidepressant agents. So if you take the antidepressant group of drugs, we have got the subclassifications like the SSRIs, TCAs, MAOIs. All these are the various subclassifications of the antidepressant agent. So based on the neurotransmitter where there is a deficiency, as I've already discussed about the psychopathology of depression in video number 1. So based on the psychopathology, so there is a treatment which is given, which is going to bring about a balance in the neurotransmitters. So number 1 drug group which we use for the treatment is selective serotonin reuptake inhibitors. So this group of antidepressants are very commonly or generally which is used for treatment with the depression. So the examples of these drugs include citalopram, fluoxetine, sertraline and vildaxone and vilazodone. So these are the group of SSRIs that you will be using. So these group of drugs are mainly acting on the neurotransmitter serotonin. Okay, selective serotonin reuptake inhibitors. It's going to inhibit the reuptake of the serotonin, thereby making the serotonin level increase at the neurotransmitter level, which is going to improve the symptoms of the client. The next group of antidepressants are the serotonin norepinephrine reuptake inhibitors, SNRI. So it is going to inhibit the serotonin as well as norepinephrine neurotransmitters. The drugs include desvenlafaxine, levominalcipran, and duloxetine. So these are the examples of the drugs which comes under the SNRIs. The next group of drugs is the atypical antidepressants. Examples: bupropion, mirtazapine, nefazodone, trazodone, and vortioxetine. So these are the drugs which are the atypical antidepressants. If you take the tricyclic group of antidepressants, the drugs which are commonly used are the imipramine, doxepine, nortriptyline, timipramine. So these are the drugs which are commonly used in CCAs, but the side effects of these drugs seem to be very much severe. The next group of antidepressants are the MAOIs, monoamine oxidase inhibitors. So it is going to inhibit the monoamine neurotransmitters. Examples include phenylcypromine, phenelzine and isocarbazide. So these drugs which are used can also cause severe drug interactions if the patient takes certain food items, right? So especially when the patient are on the MAOI group of drugs, you have to educate the patient to avoid taking these food substances like certain cheese, pickles, wines and the herbal supplements. We have got a drug, selegiline, which is a recent MAOI with fewer side effects than the other group of the MAOI drugs. So especially when these drugs are being used, MAOI new generation drugs are used, it should not be combined with the other antidepressant agents like the SSRI drugs. Apart from these agents, you can also use the other medications to improve the mood of the client. We have got the anti-anxiety drugs, which can be used as a short-term therapy for improving the mood and to stimulate the mood of the client. So that is about the psychopharmacological agents for treating the depression. Right? Moving on to the physical therapy. So in case of depression, it's not only the electroconvulsive therapy that we use the other physical therapies like the light therapy and also the TMS. The first physical therapy we have is the electroconvulsive therapy, ECT. It is used in the depression to bring about the alteration in the neurotransmitter. So, in case of severe depression, wherein the client is not responding to the antidepressant group of drugs, or if the client is experiencing severe side effects to antidepressant group of drugs, or if the client is, in the acute stage with the suicidal ideas, which is, very severe or intense form of symptoms the client is suffering from, we do take the client for the electroconvulsive therapy, wherein it's going to bring about an alteration in the neurotransmitter. The second one is the transcranial magnetic stimulation, which is the TMS. As you know, in depression, there is a cause called as, changes in the brain anatomy, where a loss of neurons in certain areas of the brain, right? When there is a loss of neurons, there is no transmission which is happening. So we'll be passing some magnetic pulses to stimulate these nerve cells, wherein it is going to bring about the regulation of the mood in the client. So that is the purpose of transcranial magnetic stimulation, wherein we're going to stimulate certain nerve cells so that the mood of the patient can be improved. The next physical therapy is the light therapy, otherwise called as a phototherapy. So here the client will be exposed to the artificial light, especially during the winter season. So, for example, if you take the seasonal depressive disorder, right, the SAD, seasonal affective disorder. So, in that condition, what happens? Only during the winter months, the client will, be very much depressed. So, to treat that, we'll be using the external artificial light source. We'll be exposing to the client so that his mood can be elevated during the winter months. The light source which we use should be very bright, full spectrum light with the usual 2500 lux. Okay, so that is the light therapy or the phototherapy for the seasonal depression. So that is about the physical therapies. Moving on to the psychosocial therapies or the psychotherapies. Here we are using the talk therapy, which is very commonly done for the depressed patients, to make the patient to ventilate his feelings or share his ideas, right? So that is what is done in the talk therapy or the psychotherapy. You're going to encourage the client to talk, okay? Because in depression, you would have seen the patient himself will not talk, right? So you're going to motivate the client to talk. When only does he talk, we will come to know his concerns. So in case of depression, what type of the psychotherapy is commonly used? So one is the cognitive behavior therapy. The second one is the interpersonal therapy. So these two are the types of psychotherapies that are used in the depression. Now, why the cognitive behavior therapy? So, cognitive behavior therapy is going to help out the patient to change his negative thoughts, right? In depression, the patients will have their negative cognition, right? Towards himself, towards others, towards the environment, the pessimistic way of thinking, all these thoughts of helplessness, hopelessness, worthlessness, to bring about a change or modification in the thought as well as the behavior of the client. Will be giving the cognitive behavior therapy, will be instilling the positive thoughts in the patient and try to remove the negative thoughts. The second one is the interpersonal therapy. So in case the client is having any kind of the family issues or concerns related to the interpersonal relationship, he will be undergoing the interpersonal therapy, wherein the client will develop the positive interaction with the other people. Right? So this is about the psychosocial therapies that we are using. Psychotherapy is also going to help the client to regain the self-control in his life. It's going to help him to adjust to a crisis or any other current difficulties the client is undergoing. So you can see here in the image what are the benefits of the psychotherapy or the counseling. Number one, it is going to lessen the anxiety. The patient will be able to develop the greater self-confidence. He'll be able to maintain a better relationship, regain the emotional balance. He will develop the increased assertiveness, He will be able to manage the stress. He will be relieved from the stress. He'll be able to have a control in his life, okay, by setting certain limits around him. And also he'll be able to cope up with the stress or any kind of the trauma that he undergoes. He'll be able to overcome those trauma, right? So these are some of the benefits of the psychotherapy. So the next psychotherapy we have is supportive psychotherapy. So here in the supportive psychotherapy, you will be giving a support to the client, right? So various techniques that you can use in the supportive psychotherapy are reassurance, ventilation, occupation therapy, relaxation therapies, and activity therapies. So by involving the client in all those areas, it can be in terms of activities, it can be in terms of involving the patient in the various occupation, right? Giving occupational support. It is really going to help the patient to lift his mood. So that is the supportive psychotherapy. The next one is the group therapy. So as you know, in the group therapy, we have got people around 8 to 10 people who are guided by a therapist or a counselor who are having a problem which is in common. So all members will be of, cut. All the members in the group will be suffering from the depression, right? So this group therapy is usually indicated for the clients who are suffering from the mild form or mild type of the depression, wherein it will help the client to remove all the negative feelings such as the anger, anxiety, guilt, despair, and he will be able to develop or improve the emotional growth through expressing his feelings in the group. Right? So through expressing all or ventilating all his feelings in the group, he will be able to have an emotional growth. Right? So that is the purpose of the group therapy, wherein all the members will be sharing their feelings and ventilating to each other so that they will move on a higher hierarchy of emotional development. The next psychotherapy is the family therapy. So family therapy is indicated in clients who are having the problems related to the dynamics in the family. So if the family therapy is given, it is going to help out the client to deal with the intrafamilial problems or the interpersonal problems which is there in the family, and how to deal with the stressors of everyday life, how to cope up. So all those things will be taught in the family therapy, which is really going to help the patient to recover very fast, because to recover, it's very much important that we should have the support group, mainly which is the family. The next psychotherapy is the behavioral therapy. So you're going to modify the behavior which is maladaptive, or you're going to teach the client new adaptive behavior. So it includes the social skill training, teaching the clients with the problem solving techniques, assertiveness training, self-control therapy, activity scheduling, as well as decision making techniques. So these techniques are really going to help out the patient to bring about a modification in the behavior, and even it's really going to help him throughout his. So these are about the psychosocial therapies which are used in the treatment of the depression. Okay, so moving on to the next part, which is lifestyle and home remedies. Yes, of course, we have got the antidepressant drugs, or we have got the physical therapies, we have got the psychotherapies. But once the client is completely recovered from depression, it doesn't mean that the client will not develop, or the relapse of depression may not take place in the client. No. To maintain that recovery level, you have to educate the client to follow certain practices in his daily life. So he has to change his lifestyle so that he will be able to lead a healthy emotional life. So what are those lifestyle and home remedies that he can follow? First thing, he has to stick on to the treatment plan. If the treatment is to be continued, he has to strictly adhere to the treatment regimen, thinking that he's all right, skipping those medications are not going to help him. There may be chance of recurrence. Educate the patient as well as the family to always pay attention to the warning signs. So what slight changes in the mood, okay, again is feeling the feeling of depression, anxiety, irritability, or any such feelings that is not right? So those things that you have to always monitor and pay attention for those kind of feelings. Avoid taking drugs or alcohol or any kind of the substances wherein you can get addicted to, right? So these are the things that it's very important to bring about changes in the lifestyle of the client. Based on this, we have got certain mind body connection techniques that the patient can use for a healthy lifestyle, right? Number one, we have got the use of acupuncture, wherein the fine needles will be inserted into the points, okay, especially the pressure areas, wherein those nerves will be stimulated, is going to bring down relaxation to the client or relief from certain pain or discomfort. You can practice the relaxation techniques like yoga and meditation. You can make it a habit, okay. You can also use the technique of guided imagery, massage therapy, involving in heart and music therapy, and aerobic exercises. So if the client is able to keep himself fit, in his lifestyle with all these exercises or following the yoga, meditation, involving himself in the recreational activities or going out for a picnic or whatever it is, which is going to bring a soothing effect on the mind, it's going to help him to naturally release the happy hormones, which are the endorphins. Okay, that much is enough for the client to become normal and lead his life in a happier way. Right? So these are the some important techniques that you're going to teach for a client before he gets discharged, that he can bring about a change in his lifestyle. Right. So moving on to the nursing management. So what is the nursing management for a client with depression? Say the first one is the nursing assessment. If you take the nursing assessment, you're going to do a subjective assessment and the objective assessment. Subjective assessment, you're going to talk to the client, you're going to collect the information from the family, from the client, related to the inability to cope, any kind of the sleep disturbances that he is undergoing, the fatigue, whether he is abusing any kind of drugs or chemical agents, complaints of muscular and emotional tensions, and about the appetite, whether he is having a poor appetite or he eats a lot. So what are the changes in the weight over a few months? All this information that you are going to collect from the client as well as the family or the friends, right? The next thing is the objective data. You're going to observe the client for the behavior. Example, the inadequate problem solving techniques, decreased use of social support, inability to meet the basic needs, destructive behavior towards self, such as overeating, smoking, drinking, using over-the-counter medications for relief of the pain, right? So all these things that you're going to observe, and also going to observe the behavior of the client related to the signs and symptoms of depression, being alone, not talking, not maintaining the eye contact as way of performing the activities, all these that you're going to observe objectively. So that is the first part, nursing assessment. Moving on to the nursing diagnosis. Few diagnoses that you can state is ineffective coping mechanism related to situational or maturational crisis. We have got the second nursing diagnosis as hopelessness related to long-term stress, fatigue related to stress and anxiety. These are a few nursing diagnoses you can state. Moving on to the nursing interventions in general. First one is you have to provide for the patient's physical needs. So the first thing you're going to do is you're going to assist the client in the basic need, meeting the basic needs of the self-care needs, personal needs of the client, personal hygiene. So all these you're going to assist the client, because the client is having anhedonia or is having avolition, is not motivated by his own self to go and perform the activities. You're going to always be there for the client and help him out and assist him in doing the personal hygiene as well as meeting his basic needs. Encourage the patient to eat. You can give him the warm milk, back rubs during the night, which is going to really help the patient to have a better sleep. You can also plan some activities which the patient used to love, wherein it's going to improve the energy level of the client. The next nursing intervention is assuming the active role in initiating the communication. Yes, so if you take a depressed patient, they don't initiate the communication, right? It is the part of a nurse to be very active, to actually initiate the communication by sharing the observation of patient's behavior, speaking slowly and allowing the patient to take time or use of silence so that he can respond. Encourage the patient to talk, or otherwise at least you encourage him to write down the feelings, what is undergoing. Always try to provide some kind of activities or tasks which are non-competitive, wherein through the task, when he is performing the task, he may try to initiate the communication, right? So these are the interventions which are going to help the client to improve the communication skills or the pattern. The third thing is you're going to educate the patient about the depression. Educate them that the depression can be eased through the proper communication, ventilation of feelings, or sharing his ideas. So tell him that these are the important measures which are really going to give him a relief. Help the patient to recognize the distorted perception. It can be related to the negative cognition or pessimistic way of thinking. You make sure that the patient recognizes those negative feelings, and as a nurse try to link them to depression to overcome this particular problem. The next thing is very, very important. You have to ask the client whether he thinks about death or suicide. So, very, very important, if the client is suffering from the severe form of the depression, anytime he can end up with, suicidal attempt or committing the suicide. Right? So you have to find out what is happening in the mind of the client. So how can you do this? It is done through the communication. So you have to go and talk to the patient. So when the patient develops that kind of a trust, he will be able to ventilate his feelings. He may even share that he has a plan for a suicide, or he is planning to just quit his life or give away what he has, right? So all those communication, when he does, it gives a nurse a clue that he is having a plan for a suicide or committing the suicide. So when such a thing is noted, you have to immediately see to it that he gets a consultation and a therapy for the suicidal ideas. The next thing is you have to stress about the importance of following the medication regimen. Always see to it that whatever drug is to be administered the right time and dose, and also the notice cut, and also monitor the side effects or adverse effects of these drugs so that it is going to help out the client. Not only during the time when he stays in the hospital, but also if indicated when he gets discharged, educate the patient as well as the family to adhere to the drugs or the medication regimen, not to quit immediately without the intimation to the psychiatrist, right? So these are the nursing interventions that you can plan when you're caring for a patient with depression. There are many other nursing diagnoses that you can formulate based on the symptoms of the client. So this is about the treatment options that we have got and the role of nurse in caring for depressed patient. Hope you all have understood the topic. Thank you.